we only looked at groin incisions, which really are the most difficult when it comes to surgical site infections. You have a high density of bacterial flora. You have lots of lymphatics, so there's many things that can go wrong in this region. And the trial was done just on inguinal incisions, and it showed that we can actually reduce the surgical site infection rate significantly using negative pressure. The tricky thing with the inguinal region is that there is always movement. It overlies the hip joint, so whenever you move your leg, the wound surface changes. And so ideally you have to have a dressing that adapts to that. And these dressings are supposed to stay on for at least 48 hours, but ideally even longer. And due to the constant movement, you get these pockets, so you can get fluid and bacterial contamination into the wound area. And negative pressure, by design, always adjusts, because there's always a negative suction that will adjust to the wound surface. And so I think that's an important mechanism. Before we did the trial, we looked at our data, and we looked at elective procedures and infections per groin incision. And there we found some pretty horrendous numbers. So we found about 30%. So we thought if we can reduce this rate from 30% to something like 10%, that would be great. And we actually achieved that. We didn't get quite to 10%, but we got close enough to show a significant difference. Now we're in the era between endovascular treatments and open surgery treatments. And endovascular treatments, they have the good thing is that you don't have a wound to worry about. But in terms of longevity of the vascular reconstruction, I think there's still, most people would say that a good bypass, for example, can probably last for 10 years and probably not a long SFA recanalization. So in those terms, I think open surgery is still better. But these wound complications are not to be reckoned with. And there are data that shows that even if you don't die from direct complications of the surgical wound complication or the surgical site infection, you still have a higher mortality rate. So by reducing the infection rate, we don't only decrease something that is bothering all surgeons and is a hassle for patients, but we might actually be able to save lives.